My name is Dr. Christina Francis, and I'm a board-certified OBGYN. I desire for women to have the best possible health care, and for them and their children to have the best chance to pursue their goals and dreams. As an OBGYN hospitalist, I have the distinct honor and privilege to be with women and their families during the most exciting, challenging, and sometimes heartbreaking times of their lives. I also serve as a patient and human rights advocate. I believe that all human beings are created equal. One of the reasons I chose the specialty of obstetrics was because of the challenge of taking care of two patients at once. With the advancements in medical technology and understanding over the last 49 years, it is now undisputed fact that at the moment of fertilization, a distinct, living, and whole human being comes into existence. Thankfully, in most circumstances, the lives of my two patients benefit one another, and our mantra of healthy mom and healthy baby is a reality. In the decades since the Roe decision, our ability to successfully treat medically complex pregnancies has increased dramatically. There are, however, still situations in which a pregnancy complication can occur and endanger a pregnant woman's life, such as an ectopic pregnancy or an infected uterus, which I have treated hundreds of times in my 14-year career. My intent in these situations is to save the life of the mother, not, as is the case in an abortion, to end the life of the preborn human being. However, this can be done in a way that not only ensures the mother receives excellent medical care, but also respects the dignity of the life of her child, something my patients have been very grateful for. There's been a lot of false information being spread that laws limiting abortion will prevent these life-saving treatments, but this is blatantly absurd. Not only do no state laws currently on the books prohibit these treatments, but even state laws restricting abortion pre-Roe allowed for them. The nearly 7,000 members of APLOG, the American Association of Pro-Life OBGYNs, along with the remainder of the 76 to 93% of OBGYNs who do not perform abortions, know that elective abortion does not need to be legal in order to ensure we can provide our patients with excellent health care. Our position at APLOG is that women deserve fully informed consent. This should be a point of common ground for both abortion advocates and those who advocate for both patients. Women cannot receive fully informed consent on risks and benefits of any given procedure if they are not seen by a physician or other qualified medical professional, and yet we see this happening with the push for self-managed abortions via pills obtained online. This actively places women's lives at risk as they cannot be adequately screened for ectopic pregnancies, which occur in 1 in 50 pregnancies, or for an accurate gestational age, something ACOG states up to 50% of women will be wrong about without an ultrasound. Women deserve better than this kind of negligent care. I was the only OBGYN for roughly 300,000 women in rural Kenya for 3 years. I've seen firsthand what happens when women don't have access to basic medical care, and I've also seen what interventions improve their outcomes: access to quality prenatal care, access to blood products, and appropriate screening and treatment of health complications during pregnancy. Excellent health care does not include abortion. Elective abortion has no health benefits to my patients. It ends the life of one, and it often causes harm to the other. There are more than 160 studies that show an increased risk of preterm birth in future pregnancies after surgical abortions. Our preterm birth rates are already the highest in the developed world, with a disparate impact on the Black community. Women considering abortion deserve to know that once they are ready to be mothers, they could face the possibility of losing a child to prematurity. Having sat and cried with patients in this very situation, I couldn't help but wonder if they would have made a different decision had they only known. Abortion also leads to a significant increased risk of adverse mental health outcomes. The vast majority of the peer-reviewed literature on this issue shows that the long-lasting mental health effects from abortion include depression, anxiety, drug abuse, and suicide. One very large registry-linked study showed that women who had abortions had a 7 times increased risk of suicide compared to women who carried their pregnancies to term. When our country is already facing a mental health crisis unlike anything we've seen before, we should be minimizing contributing factors, not encouraging them. So what does a post-Roe world mean for my patients' health? Now we can finally have a robust discussion of the impact abortion has had. We have a chance to restore trust in the medical profession to advocate for both of our patients. It means that women have a chance at healthcare that puts their safety and that of their child ahead of a political narrative. And it means that instead of defaulting to abortion as a Band-Aid for a variety of complex issues, we will now be working to identify innovative solutions for women today, their preborn children, and for future generations. Thank you.